Scott Johnson in for Jack Pattie one more time. And as we do on Fridays, we welcome Dr. Kevin Kavanagh, Health Watch USA. Dr. K, good morning.
Good morning, sir.
Welcome aboard. Welcome back. We are back in school for many, if not most districts in this part of the world. And unfortunately, that means back to the debate over masking in schools.
Well, that's correct. And I fall on the side of getting our children good medical grade masks. I think that's one of their layers of armor they need to get back into school. And this is along with smaller class sizes, podding, and frequent testing, about twice weekly. And what amazes me is when I mention frequent testing twice weekly, sometimes I'm told that's a liberal agenda. But no one seemed to complain about it when we were testing our basketball players twice weekly. That was okay. It appears to be only controversial with our kids. So yes, I think that we're opening schools, but we need to do so a little bit safer than what we're doing now. And one of the big areas I didn't mention is also with ventilation. We really need to upgrade the ventilation of our schools to clear any viruses which are present in the air.
You talk about medical grade masks. Are you talking about N95?
N95s, KN95s. If your child by chance can't tolerate that, my granddaughter can. So, she's 8 and wears a KN95 quite well. But if not that, then at least a close to a high-grade medical mask that you're not breathing air between the face and the sides of the mask. So I think that's key. You need to realize when you talk about getting COVID-19 at school, you really have to consider viral dosage. You're not going to get the infection if you're just exposed to one virus. There has to be so many viruses. And as you go up in mask grade, you make it less likely that you're going to reach that critical viral dose. And so that's important, along with the other strategies, because that also makes it less likely you're going to get an effective dosage. But if you have a very poor fitting, low quality cloth mask, the chances of your child being able to be in a room with crowded children, poor ventilation, and possible exposure to the coronavirus and not get COVID-19 after 4 hours of exposure, that's not it's not going to be very good. A cloth mask isn't going to do that. You want to try to get the best grade mask you can for your child.
Is this something that you think the individual families should be finding, or is this something that the schools need to invest in?
Personally, I think it's something the schools need to invest in. It can be tough for some families who don't even have access to internet to find. You can order these masks off Amazon. They're easy to find, they're plentiful, but people are not pushing them. Dr. Osterholm certainly is talking about increasing mask quality, so is Dr. Wen. And I think that there are a lot of epidemiologists who are saying, look, with a virus that is targeting children, 2 times more infectious than last year's virus, and it looks like it's even more lethal, causing severe disease, we need to upgrade our protection. Last year's strategies probably won't work, and we are seeing breakthrough infections. Now, still, they're rare, especially if you've just received your vaccine, but it is of concern, and that really does throw I think a monkey wrench into anybody that has the theory of herd immunity. Once you start getting this infection 1 or 2 times, you'll know that that's maybe not a good option.
Okay. Is some of the hesitancy not necessarily on masking in general, but the fact that people aren't getting these higher grade masks, is some of that just the leftover thought that, well, those are almost impossible to get because that was the case a year or more ago when the pandemic first hit?
I think some of it is, but also last year when we had a virus that wasn't as infectious, was shedding far fewer viral particles, those type of masks, the cloth masks, did provide you with some protection. Right now, that protection is even less because of what we're faced with. And so it is concerning. And I'm really kind of scared that we're in this for the long haul. I'm not sure that we're going to come out of this wave really quickly. I was hoping that we would come out of it as fast as we were going into it. And certainly the data in the United Kingdom indicated that. But now they've kind of fallen down to a very high plateau. It's not acceptable. They're up about what they were over Thanksgiving. And so they're starting to inch back up. And the United Kingdom is very interesting because they're, I think, a similar country culturally to ourselves, and they removed their mask mandates, but yet their public is still wearing masks. 70% of their public still wears masks. They wear masks all over the world. It is just here that they're controversial. So I think that when you heard Dr. Paul's rhetoric talking about over-the-counter cloth masks, how the science isn't there to back up that they're really safe, with this variant, he's got a point. I think Dr. Osterholm probably would agree with him that for prolonged exposure, especially in a school setting, you need to upgrade the mask. The remedy, however, I would strongly suggest upgrading a mask and wearing it rather than not wearing masks.
All right, here's a call from Sue. Sue, good morning. You're on with Dr. K.
Thank you. I was wondering if someone who has Delta, COVID, just by normal breathing can infect someone else, or does it take more of a projectile like sneezing or coughing from that infected person to infect other people?
All right, the Delta variant is probably the most infectious virus we have ever come up against. That's what Dr. Larry Brilliant, who was one of the people who snuffed out smallpox, is stating, and certainly from what we are seeing, that is becoming true. And unfortunately, just talking and breathing can aerosolize viral particles. And so if you're in a poorly ventilated area, people are talking and breathing, those viruses will aerosolize. If they do not have good ventilation and they're not cleared, other people are likely to get an infectious dose. So in that scenario, being 60 feet away from someone is probably as unsafe as being within 3 feet. When you cough and sneeze, those are large droplets which are being projected out, and they can go for many feet, up to 25 feet sometimes. And so that's very problematic. But when you're breathing or talking loudly, what can happen is that the virus will aerosolize. And they aerosolize in mucus and droplets. So they're between about 10 to 100 microns are the size of the particles that will aerosolize. They can float in the air for a protracted period of time and survive up to 3 hours. And this is what the masks are designed to filter out. Now, for the anti-maskers who say, oh, but the viral particle is much smaller, well, yeah, that's the dry particle as measured by electron microscopy. That's not the particle size that is coughed out or sneezed out or talked out that's coated in mucus and droplets. Those type of particles, the N95 masks, are very efficient at filtering out. And there's also an electrostatic mechanism that can catch even some of the smallest particles. So if you have a good fitting N95 mask, that will afford you fairly good protection. But again, viral dosage is important. Can you get the virus in your eyes? Yes. That's one of the reasons why you want to try to be in areas where you're not exposed to a large viral dose.
Can I ask another question?
Go ahead.
Sure. What's the difference in an N95 and a KN95?
N95s are up to United States FDA standards. KN95s are made in China and they're up to the Chinese standards. They're probably not as good. In fact, some tests have shown them not to be as good as N95s, but in general, they're better than a cloth mask. So KN95s are a good alternative if you can't find an N95. For my granddaughter, the KN95s came in children's sizes, so we were able to purchase those. You can get these masks on Amazon. Kimberly-Clark makes them. Uline with the letter U, line.com is another company that sells them. And believe me, for myself, if I'm going to have to go into an indoor setting, I'm going to be wearing an N95. Remember, we've got cases out the wazoo right now, positivity rate of over 11.5%. Last year, we'd be closing down. This year, we're not closing down, but tons of people aren't wearing masks. And when they do wear masks, they're wearing a cloth or cotton mask. With the Delta variant, probably isn't enough protection.
All right, Sue, thank you for your call. And Rick's been waiting to talk to Dr. K. Rick, thanks for your patience. You're on WVLK.
You're welcome, Scott. And Dr. Kevin, thank you for your input and your knowledge on everything. And I apologize if this has already been addressed, okay? Dr. Kevin, could you do what they did with the Salk vaccine for people that are scared of shots? Put it on a sugar cube. I mean, I'm not one. I've gotten both of my shots, ready to get a booster if I need it. What about the people that are scared of shots? Could they do it on a sugar cube?
I would hope so, because I fall into that category of being scared of shots. That's unfortunate, I know, but I do. And right now, they don't have that technology of doing that. But certainly that would be a good advance, because it looks like we may need boosters frequently. Frequently, I mean possibly once a year, possibly even more than that, because this virus doesn't appear to be doing surging just once a year like the flu. It's many times a year, or at least twice a year. So, yes, that's something hopefully they'll be able to develop.
Right. Well, that could be Kevin and Rick's contribution to medical science.
Yes, thank you.
Thank you, Dr. K.
Thanks, Rick. Appreciate the call. We've got a few texts here. Let's see if we can get through them, Dr. K. This one says, I've noticed that some restaurants have either gone back to having all their employees wearing masks or not wearing masks at all. So I guess the question then becomes, we've talked about the emphasis, of course, at this time of year is about what's going on in the schools. What about the rest of the world?
Well, I would be myself not doing indoor dining. I would certainly be doing pickup or curbside delivery. I think that's the wisest. I don't understand how you can eat and not take off your mask, and whenever that happens, you start talking, etc. So this, as I said, this virus is very infectious, very problematic, and this is a variant that we're seeing that is unfortunately mutating in the wrong direction. There are others out there, so we need to learn to live with the virus. And at times when caseloads are high, like we're seeing right now, I think we need to be extra cautious. So for me, I wouldn't go into a setting where people are not wearing masks.
Next texter says, I'm a school bus monitor for preschool and kindergarten children. We are exposed every day to coughing and sneezing in closed areas. We have our windows down as much as possible, but that's the only protection we have. What type of mask should we be wearing?
Oh, that's an easy one. An N95, I would put on goggles, and to be honest with you, I'd even wear a jumpsuit or a gown. And if you did that, you'd have some good protection, or at least adequate protection. Remember, if you're in a school bus setting and you're scared, well, doctors work in COVID-19 wards all the time. But they have on high-quality masks, they have on goggles, and they have on a gown. And so in a crowded setting like that, that may be what you need to use. And certainly I would keep the windows down so that you lower the viral load. Because what you want to do is to keep the number of viruses you're exposed to as low as possible. Not only will that tend to keep you from getting infected, but if you do get an infection, a lot of people think that that will be a milder infection than if you're exposed to a lot of viruses at the get-go.
One more text. He says, I'm at 6 months with Pfizer vaccine. Am I no longer protected?
Well, yes and no. It would depend upon your age. You still have some protection, but according to the Israeli data, this shows that the protection tends to drop off in those who are over 60 who are more than 5 months out from the last dosage of the vaccine. And so I'm in that category. I'm being very careful because of that. And the question that many people say, well, should we rush out and get a booster? Well, I would certainly talk to your physician about that, because remember, if you go out and get a shot now, you're going to get last year's vaccine made for last year's virus, and they're working on a more up-to-date one on the newer variants, and it may be better to hold out and wait for that, because that, I think, will give you much better protection. If you had to have, for example, a major procedure in the next week or so, I'd consider maybe getting a booster and talk to your physician about that. Of course, the FDA and CDC are meeting right now regarding setting guidelines for this. So I think boosters are going to be a hot topic in the weeks to come.
All right, Dr. Kevin Kavanagh, Health Watch USA, thank you so much.
Thank you very much.